So maybe just tell a little bit about your name and background of implants so far prior to coming to the course, and how you found out about it and why you were interested in it.
My name is Dr. Daren Larsen. I'm from Vernal, Utah. I heard about it through a friend who I went to dental school with. I trust very much, and and I trusted him, and then that helped me to know that I could trust the friend that referred him to come to this course, and so I was able to come. I have quite a bit of implant placement. I've placed lots of implants, had lots of great success. Wanted to take it to the next level, and this is it.
Awesome.
This was the course.
What's been your experience so far?
It's been phenomenal. Been very good.
Any big highlights or anything that really jumps out at you?
Some of the biggest things are the amount of wet finger dentistry that the actual instructor does. Dr. Kim does so much on his own that it makes it so good for, and then but he backs it up with the research as well. And so he's got the clinical experience and clinical expertise, and that translated to me, and also being able to have the research base, and then to be able to show all the different things that he's done. But I was able to do a very cool sinus. I was able to get into the sinus and really, get to a feel of how, because that was the next level for me, being able to do sinus surgery and be able to, do sinus lifts and things like that.
That's awesome.
So, yeah.
Had you done any other implant courses prior to this?
Yeah, I've done quite a few other implant courses. None like this though. None that were, we've done, manipulated pig heads and things like that. But this was phenomenal because we were actually able to go in and work on patients and be able to do those things and to be able to do a service for the patients here. So it was excellent. Very, very good. Very
That's
good
awesome.
course.
And just a couple questions about the facility, like the location facility. Some people might have thoughts about coming to Mexico or Tijuana. So what was your experience of being here at facility, location?
The facility is great. They have all the instruments that you need to be able to place the implants, all the great bone grafting techniques, all those types of things that, just phenomenal. Very, very good.
And then Dr. Kim, your experience with Dr. Kim versus other instructors?
I got to be able to be with Dr. Kim all day yesterday. So I was very lucky to be, all the others are really good too, but to be able to be with Dr. Kim was great because he's the main one behind this, and like I said, but the others were excellent too.
And how much experience did you get actually placing implants and him more on the hands-on part of that process?
Quite a bit of experience with that because they were able to, they were guiding me into the places that I needed to be and making sure we had the lineups and things like that. So yeah, I had a great experience with that too.
Okay, and then as far as like the full package, if you will, it's the clinical as well as providing some background on attracting new patients. Was that helpful?
Oh yeah. Yes, to be able to get both of that in one place, it made a huge difference. That's both sides of the practice that you need to be able to do these things. And if you don't get both sides, then you're good on the clinical part, but then you don't have the way to be able to get the patients to come into your practice. And so to be able to have both of those together, it's like, to get the cake and the icing and the extra cake besides.
Awesome. And then just plans for next steps, like, coming back, integrating things in, anything like that. What were your thoughts on that?
Being able to go to come to this course and then being able to go back and integrate things. There's a few things that I need to get as far as armamentarium to be able to get into it, but yeah, there's lots of things I'll be able to implement right off the bat.
And then any recommendations or things that we could do to improve the courses in general?
The only thing that I can see is just making it a little bit easier to understand sometimes, because sometimes there's a little bit of a language barrier. not only between patients and us, but between the instructors and us too. And that's really the only thing.
Okay, awesome. Thanks so much.
Yeah.
Appreciate it.